Hi, I'm Lawrence Bergstrom. I'm a registered osteopath at Swale Back Pain Clinic and a non-surgical spinal disc specialist. Now, in this video, I want to discuss a little bit more specifically about IDD therapy and what we call non-surgical spinal decompression therapy. One of the key myths I want to dispel is that it's a quick fix. It isn't. Spinal discs have a poor blood supply, and so they're very slow healing, unlike skin or muscle. So when you damage a disc, the discs are damaged over a period of time, and this typically is over a period of months or years. So one of the queries that we get asked a lot, or one of the questions we get asked a lot is, can I not just have a session and see how it feels? It's a little bit like going to the gym once. You can feel how the equipment feels, you can understand the process of using the equipment, but you're not going to come out of the gym any fitter than you went in. And it's exactly the same with IDD therapy. You need a series of treatments, and those treatments progressively build on each other. So each session builds on the one before, just the same as if you go to the gym, you gradually get stronger and fitter. Symptomatic relief is another question we get asked. Surely if my symptoms are getting better, then I don't need any more therapy. Now, the discs degenerate over time. So as your spinal disc degenerates, symptoms develop. Now, of course, as we improve the symptoms, we start to feel better, and nobody likes symptoms. Equally, we don't want those symptoms coming back, if at all possible. So we need to treat the disc long enough to then prevent the symptoms returning. So it's not just a case of the symptoms are better, job done. Certainly when you don't have symptoms, you're going to feel much happier. But what we want to do is, once we start your process of care and improve your situation, get you moving better, reducing your pain, reducing the symptoms, resolving the symptoms wherever possible, we don't want you to come back into the clinic weeks or months later saying, I've got the same problem again. And that leads us on to why so many sessions, because people may have 18 sessions, they may have 24 sessions, they might have 30 sessions, they may have 40 sessions, and in very small numbers of cases, patients receive even more than 40 treatment sessions. Why is that? Is that just because we want to get you into the clinic and keep you here as long as possible? No. People sometimes say, but you just want me to keep coming back again and again and again. The simple answer is, yes, we do, until we've resolved this disc problem, and then we want to essentially make ourselves redundant to you. Optimally, we want to be the last clinic you step foot into. We diagnose the problem, we treat the problem effectively, and we send you on your way to get back to life and get back to the activities that you wish to do. So there is a misconception, they just want me to keep coming back again and again and again. Of course, we understand that. We understand there's a certain amount of cynicism or concern that clinics are just after the money. No, we're not, because we want to make ourselves redundant to you. So it is a process, of course, because depending on the severity of the disc degeneration and or injury will dictate the number of those sessions. Now, some patients will have what we call an 18-session trial. That's where their medical history, their physical examination, and their MRI results lead us to believe that we can help them, but we can't be quite so certain. And then we will run an 18-session trial, provided at the end of that 18-session trial they're 20 to 40% improved, and we can positively show that through their functioning and reducing pain scores. Then we will ask their permission if we can progress a little bit further. So there is nothing hidden. There are no smoke and mirror tactics here. Typically, for a category 1 disc injury, which is the least severe, we will treat for approximately 24 sessions. Sometimes people will need a few more, sometimes they'll respond very, very quickly, and then we can meet out those 24 sessions over a period of time. Again, remember, we want to heal this disc, we want to resolve this problem, we want to help it to repair. We can't make it brand new, nobody can. An osteopath, a chiropractor, a physiotherapist, a surgeon, no one can make this disc injury brand new or this disc brand new, but we can get the functioning greatly improved. So the joints move, the muscles effectively operate much more efficiently, and most importantly, that session by session by session approach then starts to decompress the disc in the long term, encourage blood flow, nutrients, oxygen, water in there, and get this physiology within the disc, the physiological pump, working again. Once that's working again, nerve pain goes away, sharp stabbing pains go away, spasms go away, and then your function greatly improves. All the things that we experience: can't turn over in bed, we can't get our shoes and socks on, we're terrified if we sneeze or we cough, those kinds of things, that all goes away over a period of time. But we're very transparent with all our patients. This is a process of care. There is no quick fix. The surgeon will say the same thing to you. There is no quick fix. If you go for surgery, the surgeon will say, these are the outcomes we expect, but you may still be left with certain problems. Now, when we treat you, we're not invading tissue through invasive surgery. We're not prescribing medications to you, and we're not injecting. So you'll appreciate this is a natural process that has developed over time to then become unnatural in terms of inflammation, sensitization, and pain. We need enough time to reverse those processes, okay? The goal of therapy, ultimately, get this disc functioning well again, get these joints functioning well again, and then you'll be well on your way to functioning, healthily and happily again. So just to be clear, if you are being considered for IDD therapy and non-surgical decompression, this is a tool, it's a part of your care. Now, people tend to look upon it almost a little bit like a sunbed. Well, I'll just come along and I'll lie on it and I'll see how it goes. If I'm feeling any better, maybe I'll come back again. You won't get a process of, or you won't get a care plan from us based on that. That will never happen. First, we need medical history. Then we examine you thoroughly, orthopedically, neurologically, osteopathically. We review an MRI, which is no older than 12 months. We bring all of those elements together. Now we have a diagnosis. Now the diagnosis and the changes on your MRI will dictate whether we're looking at 18 sessions, 24, 30, possibly 40. Okay, most of our patients sit around the 24 to 30 treatment sessions and they do extremely well, and that's long term. We have long range data spanning over the last 5 years where patients had treatment 5 years ago, they've had no problems since. So it's a process, it's not a quick fix, one session won't get you there. So I hope this information helps you. We'd be delighted to discuss any further queries or questions you might have, because we want to make sure we're a great fit for you and you're the perfect fit for us, and then we have great outcomes. Thank you for watching.